Hi there, it's Bill Swan, lead agitator for facesofpharmacare.ca. Question for you. Is the way that we pay for drugs in Canada killing Canadians? Pop quiz. Is healthcare in Canada a right or a privilege? Time's up. Some of you got it wrong. Parts of it's a right, some of it's a privilege. So if you need to go to the doctor, you need to go to the hospital, it's covered, it's paid for publicly. You don't have to pay out of pocket. You have access, unfettered. If it's drugs outside of the hospital, it's a privilege. If you're elderly or poor, you probably have a drug program through your provincial government. If you have a decent job, you've probably got group benefits and you've got coverage. If you have enough money, you can afford the crazy premiums for a private plan by yourself. Then there's those 3 million problems of Canadians who don't have decent coverage or coverage at all. What do you do with them? The key here is that when you view healthcare as a privilege, you change the dynamic of how that system works. You want an example? Look south of the border to the US. They view it largely as a privilege. That's why you have insanity going on and crazy cost increases and crazy cost period. People getting denied coverage, people going bankrupt. That's what you get. And we have the same thing happening in Canada in prescription drugs. Now, an interesting thing that happens when you move into the profit market, when you have private drug insurance companies, magically, patients don't really matter as much as profit. So if you have a pre-existing condition and you don't fit in any other mold, tough. A friend of mine from a previous life, Joanne Spetz at UCSF, she said that if you believe that healthcare is a privilege and you take that to the extreme, you have to be comfortable with people dying in the streets. I think she's right. And you know what? I think Canadians got comfortable with that. So I asked the question, is the way that we pay for drugs killing Canadians? And I think it is unequivocally yes. Here's why. Did some research, didn't just pull it off of Google. I looked at a number of papers, but I boiled it down to two that I think are worthy to look at, and I've got the links on my blog. The first one looked at a shortage of norepinephrine in the States in 2011. Norepinephrine, life-saving drug, very important. Not surprisingly, when there was a shortage, people died. The second looked at what happened to the Medicare population when they added drug coverage. The mortality rate in that population went down 2.2%. Having access to a program like this saved lives. So if we look at this from the Canadian context, take that 2.2%, go back to 1966 when we forgot to finish the healthcare system by adding drugs. That's 225,000 people that may have needlessly died because we didn't bother to finish our healthcare system. That is more people than the population of Kitchener. That's a lot more people than the population of Prince Edward Island. And now, right now, the statisticians are going crazy. The econometricians are going nuts. It's not generalizable. What model did they use? You know what? It doesn't really matter. What you have to ask yourself is this. How many people are you comfortable with dying to maintain the system and the profits the way it is now? To me, that number should be zero.